Hello, I'm Hannah, a biomedical science student, chatting with Dr. Sarah Pontefract, a lecturer in clinical pharmacy and therapeutics and the editorial lead for the Script e-learning programme in the School of Pharmacy at the University of Birmingham. Thank you for joining us today, Sarah.
Hi, thanks for having me.
How have you been coping with lockdown? Any reading or viewing that has got you through it?
How have I been coping with lockdown? It's been okay, and I think I fell into a new routine quite quickly. I'd say it's had its ups and downs. I have a 2-year-old, so it's been lovely to see him more during the day and being able to have breakfast and lunch and dinner together without needing to rush to nursery and to catch the train to work. I've really enjoyed the challenge of needing to adjust quite quickly to situations such as with the redesigning of exams, which has really provided an opportunity to innovate and highlight areas that we can potentially approach some aspects of teaching and assessment differently. So that's been quite nice, and keeping busy has been really helpful with managing lockdown. I've been keeping up to date with the management of the clinical trials, so the clinical trials nationally and internationally, not only from the point of view of my own e-learning and the content we develop, but also because I get questions from patients and the public. In terms of viewing, I'd say it's mostly consisted of watching Zoom on a daily basis, the 5 p.m. briefing, and I'm not going to lie, I have watched Tiger King like most people did in isolation.
What are you most looking forward to when we get back onto campus?
I can't wait to see my colleagues again in the School of Pharmacy and in the wider college. I share an office with, there's 4 of us in an office, the Script editorial team, and I miss our cups of tea and early morning discussions about how our commutes have been and how our evenings were. I also miss the impromptu discussions in the corridor with staff and students and being able to catch up in meetings with both of them. It's been strange not to see and support students during the exam period, so I'm going to really appreciate having that normality back.
We've had to adapt to new learning and working practices in recent times, but e-learning is something you've been involved with for quite a while now. Can you tell us a little more about the Script e-learning programme?
I can. So Script is an e-learning programme which is funded by Health Education England, and it's developed here at the University of Birmingham. So in the School of Pharmacy, we have an editorial team where we develop the content for healthcare professionals, and we work with specialist healthcare professionals to write that content. The project started back in 2010, so it's been going a good 10 years, and originally it was a relatively small scale project to improve therapeutic knowledge and prescribing of just junior doctors in the West Midlands. The programme was really well received, and it did prove to be a success, so we started to disseminate the learning nationally for junior doctors. But also we started to develop portfolios for dentists, paediatric specialist trainees, general practitioners and nurses. So to kind of give you an idea now, so in 2010 we had 250 junior doctors engaging with our learning who were kind of in a pilot phase, whereas now we have over 17,000 healthcare professionals interacting with our learning each year. So hopefully we're having an impact on enhancing knowledge around prescribing and hopefully reducing the rate of medication errors across the NHS.
That's so interesting. So coronavirus, COVID-19, has had a huge impact on all areas of healthcare. But what impact do you think it has had on your research interests, such as medicine optimization and the use of electronic patient records?
The electronic patient record has proved to be really useful to those working in the community and the hospital setting who have access to the technology. So for example, in hospital, it's meant that staff can review patients' notes and medication remotely and not need to be in the ward environment to do this. So that frees up space for those who are providing direct patient care, and all other activities such as interfacing with the record can be conducted elsewhere. The technology can also be accessed from home. So hospitals have had pharmacists working from home, accessing the patient record via a VPN access. So if they're self-isolating and they're well enough to work, they're still being able to contribute clinically. such as with the review of medications and also prescriptions for patients for discharge. With regards to the patient record as well, there's a high volume and kind of variety of data that's generated in those systems every day. And this can be captured for quality improvement and also for monitoring outcomes. That's really useful for medicines optimization. We can very quickly identify patients who we need to focus our attention on for medication review or to optimize their treatment. And it's really valuable and has been valuable in this process for improving patient care and the delivery of care for those.
And finally, do you have any advice on how I can shape my future at this stage of my university experience?
My advice to shape your future. I would say it's great to have an idea of the path you would like to take after your degree and the career or specialism you aspire to work in. But I would say it's important not to let this get in the way of deviations from the path when opportunities arise. I never planned on doing a PhD, nor did I plan on becoming an academic, but I absolutely love what I do. And had I not swayed from my 5 or 10 year plan, I would not be doing this today. I think it's really important to have a mentor who can provide professional guidance and support. And ideally, this would be somebody who who is experienced in the job that you wish to pursue, who you see as a role model that can help you realise your own potential in the career you would like to pursue. And don't be afraid to fail. In terms of research, there will always be applications for funding that are unsuccessful, and there will be jobs that you may not get. But with each one, there is an increased determination and an opportunity to improve. So it's really important to take on feedback and really use that proactively going forwards.
Thank you so much for taking the time to talk to us today. It was really interesting to hear about your research areas and the impact of COVID-19.
Thanks, Hannah. It's been lovely talking to you, and I wish you all the best in your future career.
Thank you so much.